Nursing Care of Substance Use and Addictive Disorders. Module 2, Alcohol Use Disorder. Alcohol use disorder is one of the most common substance-related conditions you will encounter in nursing practice. You will see it in emergency departments, medical surgical units, psychiatric settings, and primary care. What makes alcohol especially important for nurses is that alcohol withdrawal can be life-threatening. Not uncomfortable, not inconvenient, life-threatening. In this module, we will focus on recognizing intoxication, anticipating withdrawal, and understanding your nursing priorities to keep patients safe. Early recognition and timely intervention save lives. Alcohol is a central nervous system depressant. Early in intoxication, patients may appear stimulated or euphoric because alcohol suppresses inhibitory brain pathways. As blood alcohol levels rise, sedation becomes more apparent. You may observe slurred speech, unsteady gait, impaired judgment, slowed reflexes, and decreased level of consciousness. At very high levels, alcohol can suppress respirations and lead to respiratory arrest. Nursing priorities during intoxication always begin with airway, breathing, circulation, and level of consciousness. Never assume a patient is just drunk. Always assess for trauma, hypoglycemia, and aspiration risk. Chronic alcohol use changes brain chemistry. Alcohol enhances GABA, which calms the nervous system, and suppresses glutamate, which excites it. Over time, the brain compensates by reducing GABA activity and increasing glutamate receptors. When alcohol is suddenly stopped, the calming effect disappears, but the excitatory pathways remain overactive. The result is central nervous system hyperexcitability. This can cause tremors, hypertension, tachycardia, seizures, severe confusion, and delirium tremens. Alcohol withdrawal is one of the few substance withdrawals that can be fatal. That is why careful monitoring is critical. Alcohol withdrawal typically begins within 6 to 24 hours after the last drink. Early symptoms include anxiety, tremors, sweating, nausea, insomnia, and elevated vital signs. Between 8 and 48 hours, seizures may occur, sometimes without warning. Around 12 to 24 hours, hallucinations can develop. Between 48 and 96 hours, delirium tremens may emerge. Delirium tremens include severe confusion, agitation, visual hallucinations, and unstable vital signs. This is a medical emergency. If you observe new confusion combined with autonomic instability in a withdrawing patient, escalate care immediately. The CIWA-Ar is the standardized tool used to assess the severity of alcohol withdrawal. It evaluates symptoms such as tremor, sweating, anxiety, agitation, nausea, hallucinations, headache, and orientation. Higher scores indicate more severe withdrawal. Benzodiazepines are often administered based on CIWA score in what is called symptom-triggered dosing. However, the CIWA-Ar requires patient participation and cannot be used if the patient is delirious or unable to respond appropriately. In those cases, alternative assessment tools and immediate provider notification are necessary. When caring for a patient at risk for withdrawal, first determine the time of the last drink, then assess vital signs, orientation, seizure history, and suicide risk. Alcohol use disorder significantly increases suicide risk, particularly during intoxication and withdrawal. Monitor closely for changes in mental status and escalating autonomic instability. Laboratory studies may be ordered, but stabilization always comes first. Airway, breathing, circulation remain your priority. Benzodiazepines are first-line treatment for alcohol withdrawal because they calm the overactive nervous system and reduce seizure risk. Common medications include diazepam, chlordiazepoxide, and lorazepam. In patients with liver impairment, lorazepam is often preferred. The goal is light somnolence, not oversedation. Continuous monitoring of respiratory status, blood pressure, and level of consciousness is essential to ensure safety. Chronic alcohol use frequently causes thiamine deficiency due to poor nutrition and impaired absorption. Thiamine deficiency can lead to Wernicke's encephalopathy, which presents with confusion, abnormal eye movements, and gait instability. If untreated, it may progress to Korsakoff syndrome, a condition involving permanent memory impairment with severe anterograde amnesia. NCLEX identification. If you see cannot form new memories, think Korsakoff. A key nursing principle is to administer IV thiamine, known by healthcare professionals as a banana bag, before glucose in malnourished patients to prevent worsening neurologic injury. This is a classic NCLEX concept. Long-term alcohol use affects multiple organ systems. It increases the risk for liver cirrhosis, pancreatitis, cardiomyopathy, peripheral neuropathy, cognitive impairment, depression, and suicide. Alcohol use disorder is a chronic disease that requires long-term management and support. As nurses, we approach this condition with clinical skill and compassion, recognizing that recovery is possible, but often requires sustained care. Alcohol use disorder can progress from intoxication to life-threatening withdrawal within days. Your role as the nurse is to recognize early symptoms, monitor closely, administer medications safely, and prevent complications. Assessment, vigilance, and compassionate care are central to protecting your patient. In the next module, we will focus on opioid use disorder, including overdose recognition and naloxone administration.